Good Monday night to you all. I'm Jessica Ralston. Welcome to OpenLine. We're going to talk about a familiar topic, but one that is timely too, because we have a big deadline coming up, February 15th. So we're talking about affordable healthcare enrollment with two of our favorite faces here. Jackie Shirego is here from Get Covered Nashville, and Mary Hunt is here, and they've got great words of advice and can answer all of your questions if you want to call in tonight at 737+. But also very timely tonight is a special session at the legislature where the governor is talking about a plan to get around 250,000 more Tennesseans enrolled in health care coverage, I think through Medicaid expansion, correct?
It's not exactly Medicaid expansion.
Okay,
it's really different from that. The governor has developed his own Tennessee plan. He looked at the ways of looking at Medicaid expansion and decided that wasn't exactly the way Tennessee needed to go.
Okay.
So it's slightly different, but it does cover many of the people whom we've said in the past weren't covered.
Right, and those people were of great concern.
That's
people
exactly
that
right.
had fallen through the cracks and had nowhere to get help.
So this is a plan to get many more working Tennesseans who don't make quite enough income to do what we've been talking about, be able to get health insurance.
All right, and it's called Insure Tennessee, and covering that side of the special session for us tonight is Mark Bellinger. He's been there at the Capitol throughout the evening, and here's a look at what he's found out so far.
Okay.
Insure Tennessee has split the Tennessee Republican Party. Today, there was one last push by conservatives asking other lawmakers to vote against the governor's plan. They shared an open letter signed by several county Republican Party chairs opposing the plan.
I think this is evidence that Republican opposition to Obamacare Medicaid expansion is growing in the state of Tennessee. And this grassroots opposition is playing itself out among legislators as well.
Lawmakers begin debating Insure Tennessee this week. The 2-year pilot program would expand Medicaid under the Affordable Care Act and provide more than 250,000 Tennesseans with health insurance. Joint resolutions must pass the House and Senate. Most Democrats are on board.
When the plan will probably help 4,000 people in my district alone, it makes a pretty compelling case.
Many Republicans are skeptical. Some believe they have enough votes to kill the plan in the House Insurance and Banking Committee.
I feel like that most Republicans would agree that expanding entitlements is not a very conservative principle, and that is why we need to stay firm in our opposition against Insure Tennessee.
The governor has been focusing on how the plan helps tens of thousands of Tennesseans without costing taxpayers. Any additional cost would be picked up by Tennessee hospitals.
The biggest selling point is that it insures up to 280,000 people who currently don't have health insurance. And the other thing is it keeps our rural hospitals and other hospitals in this state open.
Okay, so putting all the politics and the debate on that aside, can you make it clear for us, kind of clarify exactly, well, yeah, who at home sitting here tonight will this affect?
So it's designed for people who are working, who have some sort of income, okay? It's also designed for people who have no income, but who qualify because they don't have any income. Now, those people, it's going to be difficult because they're going to make between two choices. In one case, they can get a voucher to help buy insurance through their employer. So many people can't afford the insurance that you could get through an employer because it costs them too much money. So this offers them a voucher to be able to do that.
That what helps offset the cost for them?
Yes, yes.
Okay.
So it helps offset the cost, which is a very key part of it.
Yes, because how many calls have we had from people calling in and say they offer insurance to my employer, I still can't afford it.
Exactly.
Okay, great, okay.
And then the other group, the other possibility is that they can sign up for something called a Healthy Incentives Tennessee. So for those people who are not working, they can sign up, but they sign up with an expectation that they pay some co-pays. And they reduce those co-pays by doing things like not smoking. By getting an annual physical, by not going to the emergency room. So it's some of the elements that the governor has tried to put in to encourage people to lead healthier lifestyles, because we all know that those kinds of things reduce the health care costs for everybody.
There you go, right. Okay, great. Okay, so now we're going to talk about more specifically the affordable health care enrollment period, which is going on right now.
That's right.
Okay, we have a deadline coming up. Let's talk about that. February 15th?
The deadline is February 15th. So things are starting to heat up a little bit, as they always do.
Right at the
We
end.
always work on deadlines.
We
don't
always work on
Every
deadlines.
time you're here, we try to remind people.
So things are getting a little busier now, especially as people begin to do their taxes.
Yes.
So we've got this nice overlap time where people are starting to do their taxes. If they didn't have insurance last year and their income was over a certain amount, they are going to be facing a penalty on their taxes this year.
Yes, I do mine online through H&R Block, and I got the questions right away. Do you have insurance? And then it says, good, you will not be penalized. But I can imagine there are some people that are going to be penalized.
There are people who are going to be penalized. That you're penalized for each month that you don't have insurance. So even if you get it for most of the year, you're in better shape than having it for none of the year. And the penalty is going to double for next year.
Oh.
Okay?
Well, that's okay.
So that's an even better incentive to say, well, even if I didn't get around to it last year because I thought it was going to go away or whatever I thought.
Yeah.
It's time to think about doing that. Now remember, we don't use people's income for what they did last year. We use their projected income for this year, for 2015. So how much are they making between January 15 and December 15?
Okay.
That's what we're using.
Okay, and I'm glad you mentioned that the penalty will double, and it is going to happen. It's not going anywhere. All right, hi, Linda. Thank you for calling into Open Line. What's your question tonight?
Yes, I have a question. I have actually called the health market and tried to get insurance. I'm not able to work due to my husband's illness. So I stay at home, and we only have his Social Security, but the only insurance that they offer me is like a couple of $100 a month, which obviously I can't afford. So what kind of options do I have?
Well, you're going to be one of the ones who is probably hoping that the governor's plan for Insure Tennessee passes.
Right.
And if that's the case, we urge you to talk to your legislators and say, this is why I need it. Okay.
Do I need to start applying for other things, or is there some kind of way I need to get my name on a list, or I just have to wait to see what happens?
You have to wait to see what happens, but you want to call your legislator and talk to them about what your situation is. They're really glad to hear from constituents. We don't suggest you call all the legislators, okay? We suggest you call the ones that are your representatives. And if you don't know how to find those, you can look up Tennessee Legislature online.
Yes, ma'am.
And do that. And if you're not sure how to find it, let me give you our 800 number where we could help you find, based on your address, help you find who your legislators are. That's the 800 number that we're using is 844-644-5443. Now, there's probably not anybody answering it tonight, but tomorrow.
Yeah, I just hate that for her because she's one that kind of has to ride it out and see what happens.
Right. And we think there are easily 250,000 people like that.
Right, in that
the
same
governor
boat.
used an interesting example. He said, because in the past we've added people and then we took them off. What's that like? And he said, well, if I had a loved one who was not getting health care, and he told the story of somebody in Jackson, Tennessee, who had high blood pressure, didn't have any primary care doctor, didn't manage it, ended up with a stroke. Now he can't work at all.
There you go. And then how much does that cost? Right.
So he went to the emergency room and he had to get coverage, but his coverage was there as an emergency, which the hospitals don't like, his family doesn't like, and he doesn't like.
Right.
And not only that, he can't work anymore.
Oh my goodness. All right. Good words of warning. All right, Vincent, hi. Thank you for calling in tonight. What's your question or comment?
I was trying to see about how I can get insurance set up.
Well, we urge you to place a phone number. This call that we're talking about is 844 number 644-5443, and we'll set up an appointment for you to talk to somebody directly, and we'll try to find somebody that's close to where you live.
It's on the bottom of your screen. If you will leave it up there for a minute, Vincent, so you can write it down. That's the number that she's directing you to.
And that's an appointment to talk to somebody locally who can answer all your individual questions, sit down with you, and figure out what you need to do individually. And we have events going on all week long, so don't wait until the 15th just because it's the deadline. But this is the time to do it. Go ahead and get your appointment and get it done as quickly as possible.
Okay.
Okay.
All right.
All right. Well, thank you. Thanks for calling in. Okay, and we have Rudy is waiting on the line. Hold on there, Rudy. Don't hang up. We're going to take a quick break, and we'll be right back. And if you have a question, give us a call here at 737+.